Welcome to today's episode of HSO Healthy You University, where we team up and collaborate with HealthSource of Ohio clinicians and team members to share information to keep you and your family healthy.
Hi, I'm Tracy Campbell. I'm the clinical pharmacist here at HealthSource of Ohio, and I'm at the Batavia location. You might be asking, what is a clinical pharmacist? What do we do? We are a trained healthcare professional that manages and focuses on medication treatment to optimize the medication that you're currently taking or maybe you're starting, and make sure that you understand the therapy. Patients who benefit from working with a clinical pharmacist are any patients that are dealing with a chronic condition. So diabetes, hypertension, asthma, COPD. We also specialize in specific treatments like hepatitis C, as well as HIV PrEP therapy management, and any patient who has questions about their medication or they need more optimization and better support with their medications. If you are already a HealthSource patient, you can request an appointment with the clinical pharmacist. So we do offer in-person appointments at our Batavia location, as well as we're going to start our Mount Orab office seeing inpatient appointments there. But we can also do Zoom appointments as well to any of our locations. Clinical pharmacists are finding themselves in primary care more often because medication management is complicated. It is a lot to figure out, and is it the right treatment approach? Is this something that you should be taking or maybe taking differently? And we come alongside your doctor and your healthcare team, and we just help create a plan specific for you to help manage that. We can adjust medications to optimize what therapy would better suit and get you the better medical outcomes that you need. I kind of always knew that I wanted to take the clinical pharmacy route when I started pharmacy school. So I originally started with HealthSource as a pharmacy technician, and I fell in love with people. I fell in love with patients, and I wanted to help as much as I could. And so I decided to go to pharmacy school, and I felt that that would help me impact patient care more directly. And as a clinical pharmacist, I feel like that is what I do here. I help specifically treatment approach, I tailor medication therapies, I help answer questions that may be overwhelming when you're seeing your primary care provider, or maybe questions you didn't think of to ask when you were at that appointment. So following up with me and allowing me to go through that really helps the patient understand their treatment plan and be successful. Patients who are discharged out of the hospital. So that's a great patient approach that I typically do. So hospital changed their medications and we're unaware of the changes. So it's easier for patients just to load all those prescriptions into a bag and just bring them to their appointment with me. And I go through all of their medications at that appointment. I look at the bottle. I make sure that the right pills are in the right bottle, because sometimes we can throw them in different bottles and get them confused. But I can set all that up and make sure that our medication list is the accurate medication list and get that over to the primary care team. Think of me as a pharmacy ambassador to the clinical side. That's how I see myself. So when I see patients who maybe they can't afford their medications, maybe they are having adherence issues and they're forgetting to take their medications. So knowing what services we offer in our retail pharmacy allows me to connect to the patient to the appropriate services to better benefit the patient or the caregiver, whoever that is. Being able to link those two and access those services has been invaluable for our patients. When you come in to see your primary care provider and there's questions, or maybe you're not meeting the goals that they have, whether it be an A1C or your high blood pressure is out of range, you can either request to see a clinical pharmacist, or your primary care might refer you to make an appointment with a clinical pharmacist. And then at that appointment, we review everything and then kind of take it from there and what a treatment approach is best. But the clinical pharmacist is always in step with your primary care provider. We send notes if there's any changes, anything that happens, that referral is still there, and we still have direct communication with your primary care team. A clinical pharmacy visit is a regular medical visit on your insurance plan. So whatever you would pay or not pay seeing your medical provider would be the exact same as a clinical pharmacist. So the difference between a retail pharmacist that you would find in one of our pharmacies versus a clinical pharmacist is that the retail pharmacy, they don't have all of your labs. They don't have the full picture of your medical care. A clinical pharmacist, we have access to all your labs. Everything that your primary care physician or nurse practitioner has, we have access to that as well. A clinical pharmacist can also prescribe medications under your primary care team, and we can adjust those to maximize therapy and results that we see, as well as we can also order labs and tests and things like that, whereas a pharmacist who's over on the retail side, they are unable to do those things. I had worked retail before I decided to go to pharmacy school, and there was actually a patient. She always came in, she was an elderly patient. She came in with her husband, and they would always get an acid reflux medication. Well, one day she came into the pharmacy and her husband wasn't with her, and I seen she was confused out there looking for something on the shelf. So I went out there and she couldn't find the medication, and she had proceeded to tell me that her husband had passed away. And she was just really beside herself and just really upset. And at that point, I knew that pharmacy wasn't just about medications. It was about treating patients with dignity and love and helping treat the whole patient. And maybe that is just listening to what they have going on in their life, or maybe finding some stomach acid medication on a shelf, but focusing on the patient no matter where they are in their healthcare journey. I feel like HealthSource is an innovative company, and they're always thinking about treating the whole patient, not just marking and Xing boxes off of a medical form, but we really genuinely care about what happens to the patient after they leave our office, whether it be affording medication or affording food or making sure they have transportation to and from their appointments. It matters to us. We're passionate about helping you live your healthiest life possible. So ask about our clinical pharmacy services the next time you're with your primary care physician. We're here for you.